Okay, so I think we're lacking a moderator. So in sake of time, I think we'll just start with this session and try if we can end it in time. I was asked to give you a bit of an update on the Dutch Center of GRI expertise. And we're really honored that we can do that, actually, because we only started from the end, I think, December of 2020. And we visited this conference for the first time in 2023 in Boston. And that actually opened a lot of doors for us. We met so many great contacts here, and we had so many people that we met that actually had children with these diseases. So we're really happy to tell you where we are now and how we are thinking we can grow any further. So this is a disclosure. We take part in the Radiprodil trial, and we get funds to run the trial at our center. For today, I will just tell you a bit about Encore as an organization, how we work, what our ideas are behind the way we work. I will tell you something about the blueprint, how we follow up on our patients, and something about what we are working on right now. Let's see if I do this right. Yeah. So first of all, we work within an umbrella organization that is called Encore. And if you squeeze that down a little bit, it's a Dutch acronym, and it actually stands for Expertise Center in Rare Diseases, Rotterdam, Erasmus MC. So that's what it's why we call it that way. And we actually work in a pathway approach. So we try to serve NDDs that are in somewhat the same pathway. And we actually do that because we have we only want to serve diseases that we have a good and expertise clinical team on, but we also have the scientists within the same house, under the same roof, so we can talk to each other. And as you can see, we have 15 diseases. A few of them are on the left side. We have national accreditation for that, so we are the national centers for that. And the GRI-related diseases are in our pathway of the synaptopathies. So we were already working on the CAMK2, and then some of the parents asked us, could you also make a center for the GRI? And we were like, well, let's see, and we discussed about it. And since it is also a synaptopathy, and it's really related in the way the intracellular working is of these diseases, we thought, yes, let's do it, and that's what gave it a shot. So this is a bit more about the way we work. And to walk you through this, we have this clinical expert team that actually sees the patients and tries to find out the core phenomenon that they deal with. And we try to look at that and compare that to other NDDs and see if we can give them good advices or try some medication that we know of that could work. And then we go to the lab that studies the same disease. And for example, in Angelman disease, we worked on ASOs, and when the development was ready, we went into the trials with the children. So we try to build that loop for every disease that we work on. This is a bit of the blueprint of our daily work. So for every disease that we work on, so here I put in the GRI cohort. We hope that within a few weeks the diagnosis is made, we meet the children, and we meet them multidisciplinary. So Danielle Vema is in the other room, because I forgot to put her in here, but there is a pediatrician, a genetic pediatrician, there is a neurologist, a psychiatrist, a psychologist, which is very important, a communication specialist, and we all look in the same day at the child. We discuss together, where are we, what is the most needed thing to address today, and we also, of course, try to look at the parents, the caregivers, how are they doing, can we support them in one way or another. And then we make a wrap-up and we see what the next year will be like and what our focus will be. And then we see the children throughout age at certain what we call key ages. So between 3 and 4, between 6 and 7, 11 and 12, and then 15 and 17. And after that, we transfer them to our adult physician that you just saw. So it's a lifelong follow-up, and we try, of course, to give some sort of prognosis. Where are you now? Where are you going? What do we need to do to get there in a proper way? And of course, we try to look at medical guidelines or new insights and give that back to you when you come to us at your key age to see where are we and are there any new things that you can try. And of course, we also put our data into our registry and we work together with the lab for the variants that we are interested in locally. So this is a bit of a wrap-up. This is what we do, and we do that to make a nice, deep phenotype of the children, and we try to identify biomarkers to make our cohort as trial-ready as they can be. So we look at them with the multidisciplinary team. We assess them in all sorts of ways. We collect from other hospitals or our own hospitals the MRIs, the EEGs, the things that were done in the past. And we let the children, we assess the children in our brain lab, and we try to see if we can have some blood or anything to go into our biobank. By now, we've seen around 90 patients, and 43 went through our brain lab. So we're getting there, but we think there must be a lot more GRI cases in the Netherlands. We didn't see them all, and we are looking into how do we see them all. But well, it's a bit too much to go into detail. Then a bit about our brain lab. It's a standardized test battery that actually looks at level of functioning in all different domains. And it is across medical diagnosis. So we do it for all the different groups that we see within the Encore lab, but also for normal developing children, so to have good comparison. And we do it throughout childhood. So in the key ages that you saw for just a clinical assessment, they also go through the brain lab. So that comes together. Let's see. And why would you do that? Because we have been discussing about that brain lab for ages, and now it's finally there and we're using it. But what is the actual idea behind that? What we want to do is that we make developmental curves for every domain of development or everything that we are measuring in the brain to make sure that we can compare to other diseases, but also within the disease, we can compare children with each other with different forms of genetic variants, but also with different treatments being given or not being given. So actually the whole idea behind this is to, again, make our cohort as trial-ready as they can be. We know who they are, and we want to follow up how they change if we do anything during life. So that's the whole idea behind it. And then a bit of a practical thing. What does it look like? Well, this is an overview. Oh, I have to be here, of course. This is an overview of the lab, and you come in here. And at first you go to a very quiet cognition room, and there, of course, cognition has been tested, but also language. And here's the sensory room, and here's the motor room, where you can all do sorts of fun things. So this is where they are, and of course we ask the parents and the caregivers a lot before the children come, and we only see one child at a time. It's a quiet area, and it's really nicely done. I mean, they like to be there. So it actually works also for our group. And this is a bit of a schematic thing, what we are doing there. Here in the sensory room, we start off putting an EEG on, which is a nice soft cap. There's no scratching, no nothing. It's a soft cap with sponges, but it has a lot of electrodes, so we can also do some network testing on that. And during the EEG, we do all sorts of tests with eye tracking, for example, that Dr. Vemer elaborated on earlier. We give all sorts of stimuli to see what the reaction is. And well, this takes about, I think, 15 to 20 minutes. And once they have gotten used to the cap, we do all the tasks and we see how far we come. Then in the cognition room, there is, of course, the IQ, but also some working memory tasks, the parent-child interaction, and the speech-language therapist. And in the motor room, we look at walking, gait, standing, but also balance and grip. And we do an activity tracker before they come, so we already know about sleep and about the way the children are moving during the day, so we can also say something about restlessness. And we try to measure their body composition, so how much fat against muscle, things like that. So this is a bit of what we do. There's a little more, but this is grossly what we do. Let's see. So within the lab and the clinical evaluations that we do, we have a few things that we are working on right now. So the first thing is that we try to assess our speech-language results together with the group of Kristen Park. So that's going to be really nice. The group's getting bigger right now. We're working on measuring dysautonomia in sleep, especially related to the neurostorms that we were all talking about. So we're working on a protocol with wearables at home, so we can actually try to objectivate what is happening in those neurostorms. Me myself, I'm working on EEGs, comparing NMDA receptor encephalitis to children with a GRI disorder. And within the brain lab specifically, we are trying to see if we can do the eye tracking in a proper way, and we think we are getting there. And we also are looking into auditory evoked potential. So we give all sorts of sounds and we see, the reaction to that. And we're also looking at the retina, at the back of the eye. That's actually the first layer of neurons that you can actually study. And there's definitely some NMDA expression there. So we are also looking to see if that's any different from other children or normal developing children. And then, of course, we are working very hard to see all the adults. So that's why we are very happy that Dr. Krapp has joined us the last year. And we are also extremely happy with the funding of the GRI UK, so we can put all our adults through the brain lab and see what that brings us. So yeah, that's what we're doing right now. But then, in the end, our core business, of course, is to take care of our Dutch children. So we are actually trying to see them once in a while and get the best care they can get at their local physician. And of course, that does not always work, but we see that as a big task. So we asked one of our researchers to get a stakeholder map of how many people are involved within one patient with their parents. Well, you can see there's a lot of people involved, and if you need to address them all and get them in the same space, that takes a while. So this is something we are looking at and we're working at, but I think in the end that's our biggest task, to get the best care they can get nearby. So that's it. Let's see. This is our team. Most of us you've already seen. And of course, I think this is a good place to state that we couldn't have been here without all the patient advocacy that is in the Netherlands. It's at a very high level, and we're extremely happy, so we really feel a team together with the parents. And I think this one you've already seen. This is the four of us that are here, and for the last time we were here with 2, now we're here with 4, so next time we'll be here with 6, I think. So, yeah, that's it.
Do you have my slides back there? Park? Yeah. Oh, there they are. Okay. So, I forgot to take my sweatshirt off. My Grin shirt. Okay. So I'm Kristen Park. I'm one of the docs at the multidisciplinary clinic for GRI disorders in Denver. And I was asked to kind of talk about our program. And I think it was just getting started the last time we came. So I had some updates. So let's see. This is the... No. This. Okay, great. So this is kind of our... mechanism for seeing patients and how we kind of start off our workflow, so to speak. So the first would be a referral from, a family or from a conference or from another neurologist, which allows us to get records and, send them information about what's going to be happening on that day. We do meet to review all of the patients that we see a week ahead of time to kind of get things ready for what we anticipate they may need based on the review of those records and, highlight some of the concerns. They fill out some questionnaires, and so we say, okay, it seems like this family is really interested in that. Can we follow up on that before they get here, so on and so forth. And then on the day of the clinic, we typically start with a presentation that I or one of the other docs gives about GRI disorders having to do with one of the children that's there, or a new topic or new research to kind of help with education and awareness. And then we kind of talk about each of the patients that we're seeing and provide some guidance to the other specialties, the therapists, the rehab docs, and everybody's there about what each family might be needing. And then we have a wrap up at the end of the day to make sure that we've kind of closed the loop on all of the things that the family was concerned about and that we can kind of provide for them. The visit itself, we try to have a neuropsychologist meet with each of the families the day prior, and that can help with educational testing and assessment of their functional skills, their language skills, memory, those types of things. And I think that's very useful, not only for the family themselves, but also for us as a field to understand the breadth of function that kids have. I think we many times have heard from families that if they, their school's like, well, your kid has some visual impairment, so we just can't even test them, and we don't know what they can do, and we're going to have them read this book or whatever. And so I think that really is an under utilization of kids' skills, and we want to see how, and we want to have experts who can say, no, I have some tests that we can do, and I'm going to let you know, kind of what are your child's strengths and how can we help to teach them. And then we have the kids also see someone from what we call our special care clinic, and that is a pediatrician who specializes in children with complex and multiple medical needs. And so that's a pediatrician who's familiar with, how to monitor a G-tube, what happens when kids are in a wheelchair long term and may have, scoliosis or other orthopedic issues. And that visit is also paired with a dietitian and happens either before the kids come to the MDC or afterwards. And then they actually visit our MDC space where we have a number of different providers that will see them. Typically, it's a neurologist, myself, one of our neurogeneticists, a rehab physician, the main therapies that we see. The neuropsychologist usually comes that day as well, having seen some of the kids beforehand. We also have a developmental pediatrician, so someone who helps with behavior and autism spectrum disorders. And then finally, we have a social worker and someone we call a family navigator who kind of helps families access resources and deal with the horrible, complex system of United States healthcare. So this is our team, and you can see, I didn't put myself on there because I was going to be here, but we have our genetics doctor, our special care pediatrician, our neuropsychologist, our rehab doc, our genetic counselor. We have two special care pediatricians, one on the top there and one on the bottom. That's our coordinator, Riley. She is currently out on maternity leave. She had her second baby, Charlie, very healthy, everyone very happy. And she will be back probably later this year. And then we actually have kind of one of two rehab docs. This is us on our first clinic, myself and Liz and Donna. And we had planned to have a GRIN advocate of some kind of be there to help families and, maybe help with some of the kids and help make sure that they were all connected and had some contact with the advocacy organizations. But it's a long way for Donna to come. She has family in Colorado, and so she had agreed to kind of come, but I think it's been challenging. So if there's anyone with any types, it's not just GRIN 2B, with any type of GRI disorder who lives near Denver and wants to be our advocate, we'd love to have you. And you can talk to either myself or Liz. This is the other partnership that we had was an organization called Rare Science, and they make unique bears for kids who have rare diseases. And so the kids kind of get to have a questionnaire sent to them that talks about what they like their favorite color is purple, or they like baseball, or whatever. And then they have kind of an army of community people who like to sew who make these bears. And then they get them in clinic. And these are some pictures from some of the families that have visited with us. And that organization is also active in advocating for people with rare disease and trying to fund scientific efforts that will, work well for the whole community of rare diseases. So we are also involved in research. We have one of our coordinators usually attends to help families who may not yet be enrolled in our registry to sign up. We also give families information about active research as they leave. One of them is Dr. Lemke is doing a study about facial features in GRI disorders, and so we give them a QR code for that. And then we also have a collaborative project across the street. So for local patients usually, but looking at what is the incidence of germline mosaicism in patients with neurogenetic disorders. And so they are typically collecting, well, not typically, they are collecting sperm samples from dads of children with neurogenetic disorders. And so we give that contact information as well. And then as Susanna mentioned, we're working to standardize some of our assessment tools with some of the other centers. And I know Liz is working hard to try to get going some other centers within the United States. And so hopefully we will all be trying to assess many of the same things. I think it can be hard because our systems are organized a lot differently, but we're working at it. So these are some statistics from our clinic. We had our 8th clinic just recently in June. In total, since 2023, we have quarterly clinics, and so we've seen a total of 35 patients. This is kind of the breakdown. We had this discussion next door about GRIA. We've seen 2 GRIA patients thus far, and we have several more scheduled this coming year. That's the breakdown of locations. So we've seen mostly patients from Colorado, but we've also seen a number of patients from the Mountain West, which is the region that Denver, Colorado kind of serves, and then a number from other states within the United States. We see patients throughout their lifespan as well. So we've had some older people come and visit us, and then some newly diagnosed babies. We had also kind of set some limits initially because we wanted to get started about seeing international patients. I think we would love to see international patients. I think we tried to see someone from Canada and we had some insurance issues. So I think that's probably one of the barriers, but we have a team that can help and see what we can do. And then we had also talked about kind of reserving things for people with pathogenic or likely pathogenic variants. I think we can review other cases on a case-by-case basis, especially if a clinical team thinks that the variant is causative, especially for GRI, as we've been talking about, that it's highly likely that they get a VUS diagnosis because there's not as much known about them. So I think we will kind of review that a little bit. These is a busy slide, but I just put up a little bit of feedback. So we are soliciting feedback from families and surveys, and that's given us some ideas to, alter our summary and to follow up a little bit after our visit and to, kind of change a little bit of our workflow. So just a few things that we've discovered. We've done neuropsych testing on 7 patients, and we're just putting together a manuscript for the neuropsychological field, again, about this issue about how do you test, how do you learn about people with rare neurogenetic diagnoses and give them the best chance to have a good outcome in their tests, and how do you support them in school. So GRI is going to be included in that. We do feel like we need to make sure that we have some behavioral support at our clinics. And we've seen a lot of patients taking GRIN-specific medications, which has been really insightful for me. We've had a number of patients who are on the epilepsy aphasia spectrum or who have ESES. And some of those patients improved on their own. Some were not, responsive to a lot of treatment and were very refractory. And then I think we typically associate that, or the literature has associated that with largely GRIN2A patients, but we have seen it in some of the other genes. And so I think that will be something that we want to learn about over time. So we are going to have more clinics in 2026. We're going to be, those are the dates, and they're going to be full days, so seeing a lot more patients. The clinic does occur on typically on the third Friday of the month. And we have a pretty big waiting list. And since we've been around now for a couple of years, we are starting to see some of our follow-up patients, because we want to see somebody every couple of years or however often families can manage to travel. And so that means a big increase in access for last year, where we only had a half-day session 4 times a year, or 4 times a year, yeah. And I think this is going to be a kind of an ongoing process as we balance with our other clinics, because we see a number of other neurogenetic diagnoses. And so I think kind of trying to figure out what is the need after we get through a large amount of backlog, if there's new centers, if there's research that's ongoing, and sometimes it's hard for families. So I think we're just going to have to be flexible in how often, we offer clinics to serve the needs of the community. So that was the contact information, and happy to take questions, as I'm sure Susanna is, and that was it. Sure. Oh, I think I have a red one, yeah. Oh, here's mine. Oh, it doesn't. I can't do it anymore. Yeah. Thanks.
Just a quick question, right? Because we're getting slides up, right? Yeah. Okay, good. Just a quick question for you, Dr. Park. You mentioned that there are potentially new centers opening up, and I think Boston and New York was listed. Can you say more about potential centers in other parts of the U.S.?
Yeah, so I think that's largely Liz's department, because she's the one kind of in charge of that, because GRIN 2B is the one that sponsored some additional funding for the clinic. So I know that she's been in some negotiations with a neurogenetics doc in Boston already, but as you may suspect, things move very slowly with bureaucracy and the chaos and the whatnots. And so I think they're still very active in working on that. And then, I know that Jennifer Bain has a lot of interest in this. And so I think they're kind of considering where they want to invest those, that time, do we want to kind of break up the country and do that kind of thing? And so I think that's still being worked out.
I have a question for both of you guys, actually. Sorry, I'm going to make it quick. It's the same question for both of you guys. I coincidentally lived in Denver for 10 years before moving to Germany and having my GRIN 2B child, which is the story of my life, and now I wish I were back in Denver. But so my question is, coming to the Netherlands from Germany or coming to Colorado from Germany, like how does that exactly work, or does that work? Like, is that possible?
It's very possible. And we, as you do, I think we have an international organization that can actually be in contact with you to see if it would be provided by the insurance, or that you would have to pay for some of the things that we do, but you're very welcome. I do think that Germany will come up with a center as well, but I can't really say when that will be. So in the meantime, you would be very welcome. Yeah.
I think same. I think we would love to have you come too if you wanted to stay with family. I think the insurance is probably a little bit more complicated for the United States than it is for another EU country. So, but we have a team. If you wanted to send a message to Riley, we have people who can help with that.
So my question kind of piggybacks on what they're saying. I'm here in Florida. I have a GRIN 2A 4-year-old who is ventilator and G-tube dependent. So for us to travel to Colorado is a significant deal. Not that it can't be done, but it's very complex given her situation. So I guess my question is, what are when you say referrals and you have waiting list, et cetera, like what are the qualifications in order for us to even get her into your clinic? Because if it's not even a possibility for her, then, we're just we're just trying to find whatever
Yeah,
resources
I hear
we
you.
can
I
at
hear
this
you.
point.
I don't think there's a whole lot of qualifications. You know, we usually just say we want you to have a diagnosis of a GRI disorder. We take kids of all ages. We can't do telehealth, unfortunately, so the licensing requirements do not allow us to practice where, you know, unless we had a license in all of these other states where patients reside. You know, I will say that I'm familiar with an organization called Mickey's Miracles, I think, that is like a charitable organization that helps families with epilepsy fly to care and provides support for medical flights. And so I think that might be a good place to start. You know, for other families in our region, a lot of them like rent, you know, trailers and campers and drive from Kansas or wherever. I know that's obviously quite a big deal from Florida, but you know, I think that's why Liz is interested in setting up other centers so that families don't have to travel so far.
I was going to say something to piggyback off that. There are other organizations, like the National Organization for Rare Diseases.
Yeah, NORD. Yeah.
They have a travel assistance grant.
A travel assistance grant from NORD. Yeah. Yeah. Yeah, I think Dennis was next. Yeah.
And what was it? Mickey's what?
Mickey's Miracles, I think. Health, Hope, Live. Yeah. I'm just saying it again for the people online, so.
So firstly, just a quick comment. I think we will open also one in Texas. But it's unclear, but probably this year at some point. So the question I have is, so we have also specialty clinics for other neurodevelopmental disorders, and for us, the effort is the reimbursement of the effort is really challenging. So
The what effort?
the reimbursement of
yeah.
the. So how is this? How's the situation in Colorado, for example? Do you feel you need philanthropic funds, or you can just do it as you want?
Yeah.
And to which degree you guys would consider aligning on intake forms, which are identical and could be added also for us? And then we have automatically always research data.
Yeah, so I think that's what I was talking about with standardization between the clinics. So we're trying to make sure that we can do some of the same assessments. I think the challenging part, at least for us, is that research and clinical care are separate and require different, you know, billing. So I think whereas in the Netherlands they can do all this fancy research and clinical care and wrap it up in the same thing, here that has to be done in very different buckets. And so currently we are really operating on a clinically based bucket without a lot of the additional research funding. And so most of the support that we have is to pay for the time of the clinicians who are you know, supporting those clinics. I think it would be great to integrate them a little bit more over time. But I also think as new centers are added, we definitely want to standardize the assessments and the intakes that we're doing so that we get similar data that can be then, again, pooled together.
The coordination is also offset.
Yeah, the coordination is offset. Yeah, that's staff. So Riley's time, my time. But I think, again, it's still limited a lot to clinical care and not as much research because of how the U.S. healthcare system works, or doesn't.
But I do think that as clinicians, we try to find out the same things before they come. We already want to be informed about what the history looked like. And we also ask them, when did you use what medication, for how long, and what dosage? So all these things, we can do the same, I think, before they even enter the center. Yeah.
There's an update from Liz here, and then I think
Oh, okay,
this
great.
lady is next.
So, I mean, Liz had to leave. I'm not Liz. Liz is the president of Green TV Foundation, but she had to leave from a flight debacle. So
no,
I asked
that's
her
terrible.
about the question, and she said there will be an update in the fall, but there will be an East Coast center, and they're just waiting for hospital bureaucracy. So again,
Again,
U.S.
yeah.
healthcare system hard at work.
Okay.
What? Yeah, there will be an announcement in the fall. It'll be up. It should be up and running once the hospital contract situation goes through. Anticipating.
Yes. Oh, okay. Well, I do, but I shouldn't say, apparently. Okay, check. Yeah. Oh, yeah, okay.
So I'm from Columbus, Ohio. I work at Ohio State, and I'm here with my daughter, actually. But I do a lot of registry work, cardiovascular registry work. So we're comparing our hospital to hospitals nationally. And as I look at like all these presentations, and you have some data, you have data from around the world. My question to you is, I think in one of the sessions it talked about the fact that there were some updated guidelines with how we should be treating these patients. And I wonder if we're using that data to drill down to compare not only in the U.S., but how do we compare to other countries? Are we following guideline-directed medical therapy?
Yeah.
And
don't
if
know that
not,
they're-
why not?
I think
what should we be
people were
doing?
talking about developing guidelines. I don't know that I didn't hear that there are guidelines, but I'd be happy to talk to you about it. But yeah, I think that's important. There are certainly guidelines for many other neurogenetic diagnoses, and I think we're maybe talking about developing them.
There's
But
some guidelines from the gene reviews for the 2A,
Oh, for gene
2B,
reviews,
and
okay.
GRIN 1 out of the top of my head, which gives some tables with management, and you can all access it. It's free. With clinical cares and management.
Okay.
So that's what I use as a basis.
Okay, so
But
then I
not
don't
like a
know
real
that we've
guide.
done the work to kind of compare, but I would anticipate that that is typically is focused on therapy, access to specialists, and other kind of surveillance type guidelines that a multidisciplinary clinic would definitely do.
And let me add, that's a big motivator amongst physicians when you start comparing how we're doing compared to other physicians. Actually, at my hospital, the physicians get a report card about how they're doing, and that's very motivating because, of course, you're all valedictorians and you want to be the best. And so I don't even have to explain the data. If the data's clean, they go, oh my, I need to improve this, don't I? Yes, you do.
Mm-hmm. I have one question here from the father. I don't know how long we still have.
10 minutes.
10 minutes? Oh.
I hope this isn't redundant, but I guess my question is just, I'm wondering specifically how this is supposed to be incorporated into the child's overall care. I mean, we have a pediatrician, and we have a neurologist, and we have a GI doctor, and is this designed to replace all that or to incorporate in? Or are we supposed to decide for ourselves how we work that in together?
Yeah.
I mean, what's the place of this within our existing plan of care?
Right. So I think I would say that, again, this is what I tell families at clinic, is that I think the clinic is kind of twofold and has different purposes for different people, right? So I think certainly there are some families who don't have access to good care where they are. They don't understand their diagnosis. They don't have anybody who can help with one or more of the issues that their child is having. And so then I think we want to be a place of expertise for them so that they can get that information and take it back to where they need to be. And I think that exists in various degrees for lots of families. Maybe they're doing really great for some issues and really poor for other issues, or maybe they're doing great for everything, or what have you. Then I think the other part of it is that, it's a place where we can get better too, right? Where you're coming and we're seeing more and more, if you talk to a neurologist across the country here, most neurologists are going to be like, well, yeah, I've seen one patient with a GRIN 2A diagnosis. And the next person you see, I've seen 3 people with glutamate receptor disorder. But if you centralize them all at the same place, then you can say, okay, now I've seen 15, and I know that this is different than what's been going on here. So I think that is helpful for us to start putting this information together. I think most of the time, we're too far removed for most of the families to become their primary care team, and we don't see kids often enough to take over day-to-day management. But I think what we can do is give you something to take back to your neurologist or your pediatrician that says, hey, have you thought of this? We were talking about using this medication because people have said that it's been really good, and then we can act as a resource for that, neurologist to call us and talk it over, and or you to say, we tried that, it didn't work very well, and then I can be like, okay, well then maybe I won't say that the next time, or what have you. So I think it can act as it kind of acts both ways, and depending on what exactly. Right. Correct. Yeah.
Shared care. I had, who was first? Because you also had a question, no?
Sorry. Oh, I didn't see your hand. I was just going to say, we went last year, and I can be a testament to that. They were fabulous, and we have a great neurologist now in San Antonio, Texas, and so he has been wonderful at saying, hey, if Dr. Park wants to reach out, if you have a question, have her my chart me, and we can go from there. And, you know, I've already messaged him 3 times about what I'm learning here. So very open to being a part of the team of Jack. So if you have a good team already, then there'll be no issues bringing in their team. So.
Thank you. Well, first of all, thanks for your commitment and dedication, especially to these kids. There's definitely a lot to learn. So I have kind of 3 questions, but they're related one to the other. So I think that you mentioned that for Colorado, we will need a referral. So that referral can come from the pediatrician or primary care. And I hope that they will know, you know, about this clinic, because probably they won't, but, you know, I hope that anything that they can give us can work. The other one, like, how many days does it take to go through all the assessments and the clinics?
Just 2, yeah. So
2 days.
You know, if we have room for neuropsychology the day before, and then the visit the next day.
Okay. And my last question is, then what's the first step, or how can, you know, I can start the...
I guess we didn't find out how to put the slide back up, but that was to
The email?
Yeah.
The email address? Okay.
Yeah.
Thank you.
Yeah. And someone is monitoring that while Riley is out on maternity leave.
I just want to say how excited I am for the rest of you, because there was nothing like this for Tristan. I was the GRI Center 30 years ago. So this is wonderful, and I hope you utilize it. I will tell you, Tristan's neurologist now has access to the GRI sites, and he'll be in there tomorrow reading all of the stuff that happened today. If you find somebody who is excited and curious about your child, it can be a wonderful experience.
Thank you. Nobody, can I inventory how many people? No? You possibly?
Yeah, of course. Excellent. Question that is relevant to my region, but I imagine it might apply to, you know, folks with similar setups in other regions. I live in Boston, and Boston Children's Hospital currently has a really well-established clinic for Rett's, which I know has a lot of shared features, at least in particular with GRIA 2-related neurodevelopmental disorder, which my daughter has. So I'm wondering to what extent you would recommend folks like me and others in a similar circumstance utilize those specialty clinics for related disorders, sort of like to what extent, in what areas perhaps can they be useful, especially if travel is really difficult, or you know, they're a more local resource for regular check-ins, what have you.
Yeah, I think part of that is, again, what are the criteria for the clinic, right? Like, I think there's a clinic at CHOP that is like genetic epilepsies. And so you can have whatever type of genetic diagnosis to get there, and you know that there will be experts in neurogenetics. There will be people who are experts in the kind of typical clinical presentations that entails, which is typically, you know, neurodevelopmental issues, movement disorders, epilepsy, right? And you're going to have a geneticist of some kind, or a genetic counselor. So I think that if that's the kind of nature of the center, then I think that's probably a great place to go and get some help and get some resources. I think there are other clinics that are, again, quite specific as far as their diagnosis goes. And so they may be only for patients with problems on the 15th chromosome, which is one of the ones we have, or Rett syndrome. And if you don't have a diagnosis of that syndrome, then you may not be able to get into that clinic. And so I think it kind of depends on what the option is. If it's kind of a more general clinic, like neurogenetics, then great, go there, because I think that's a place where people have at least a framework to understand what you're talking about and resources to help you. But there are other ones that I think you may not be able to get into based on what the diagnosis is.
No, I think that exactly goes the same for, I mean, the Netherlands is really, really small, and you only have like 70 pediatric neurologists or something. We all know each other. But then again, we do know which colleagues we speak the same language and which we don't. And then we try to, well, coach them as good as we can. Yeah.
I was just going to piggyback on Ted's question, but you just kind of touched on it, Dr. Parks. But I also am fortunate to have a good team. But in that same city, there's a clinic that does a multidisciplinary. And because my son is older now and is changing some of his ways, like more storms, our developmental pediatrician recommended the multidisciplinary clinic, and which has been there forever, but we don't want to send our kid there. But but I'm very excited now because there's different eyes on him, and they're going to look at a different realm of things and look at them all at the same time outside of his comfort zones. And so those are why you would want to, I would love to come to Denver. We'll start here. And then
I think
go from there.
MDC clinics, I think, are very helpful for families because they bring together all these experts that sit together, that talk together, that work together, and help to use their knowledge in the best way that they can without having to make 17 phone calls over the course of 2 months. Right? You're all sitting there together, learning and helping.
Okay, so we're bringing Kyler to the August clinic, and we don't have the Thursday neuropsychology appointment, so I'm just curious of what we're maybe missing out on.
Yeah, I think that's hard because it's a time-limiting factor, right? We only have one neuropsychologist who has so much bandwidth, and she's trying to test a lot of kids. And so I think we're, at the moment, trying to, target slightly older kids who can participate in a little bit more testing. And sometimes we invite families back to do that, maybe at follow-up. And so we're hoping we can kind of expand that as we have more staff.
Okay, any more questions?
What? Oh, Jack didn't do that either, apparently.
So thank you both for presenting first, but also just to mention, I wasn't able to stay for most of the session, so I don't know if this came up, but just to note that, so Sergey Brin, who is one of the founders of Google, and there's lots of these billionaires that have pledged to give away 95% of their wealth before they die. He's one of the ones who's actually doing it, and he's spending it all on CNS. And so his last project was Parkinson's and donated hundreds of millions of dollars to that. But now it's autism, and so they've just launched, I'm sure you guys have applied for it in the US, but they've just launched a program to create autism centers of excellence. So anyone with an autism diagnosis would be eligible to go, and almost all of the GRI genes are eligible. So there could be a lot of new centers of excellence that our patients, like interdisciplinary places that our patients could go, and they're trying to do it quick. It could be in a year that these are up and running.
Yeah, I think that's great to hear. I think it's a big challenge always is who's doing what and how can we get them all to communicate together. And I think in an ideal world, all data would be freely accessible to all people and all centers and all resources. But, we kind of all know that that's not necessarily how it works. So I think you need to use the resources that are available to you and that are easily accessible for you and that, have the best chance of getting you the support that you need.
Okay, I think one more question.
Can you speak to the cost and getting it covered by insurance? How likely is that?
Yeah, I wish I could. I think it's quite variable, a bit based on insurance company, whether it's private or public, and kind of how aggressive people are, and what state it's involved in. So I think it's quite variable, but I think we do have a team, again, of people that can help with that. So I would say email the number, and we can kind of walk you through the process of doing that. That itself is a whole journey.
Just also from different disease, but similar issues with insurance for people out of state, particularly. So it's really important to discuss with the clinic where you want to go in the US in particular, what you want to accomplish and how well your setup is at the moment. and then make an informed decision if it's really worth it going. Because it can be crazy expensive if you could go for like a week EEG and whatever and sometimes it's not needed. And sometimes also you can talk to your local provider, hey, can we do an EEG, and I bring this disc or whatever and send it, and you save $5,000. So that's a good discussion, which then there's these experts who are really focused on insurances, and they have these discussions and really set the expectations of the visit right, to be not surprised at the end. In the US, it's unfortunately, in other countries it's different, but here you have to really...
Right, and to know, again, yes, as Dennis said, what you expect from the visit. Where are you on that spectrum? Are you one of the people who doesn't have any resources and really would be super helpful? Or are you one of the people who is doing really well and you would be coming just for us, and maybe it's, big burden for you? And so then I would say, then maybe you're okay where you are, that's my big, I don't want it to be a burden for anyone, but I do want to be helpful for people.
That's a nice closing remark. Yeah, if we do have time, we just go on.
I'm sorry. I know we're out of time. I just have a quick question. For those who can't get into you, are you guys willing to be resources to providers that are local that can contact you, even if it's not patient specific?
We field lots of email questions all the time from people from all over the country. So I think it's it's kind of a delicate balance, right? Because we haven't met the child, but I think if it's provider to provider, then we feel a bit more comfortable in kind of providing some advice and talking through things than it is if it's just a family contacting us, or not just a family, but a family who's contacting us. I think we just feel like the discussion can be, those ground rules are kind of already understood, and the discussion is at a level that we can make sure it's helpful. But we field, and I'm sure you do too, field questions, from all over by email.
Okay, great.
All right, no more after this. We're done. I need a glass of water.
Last question. Hello. So sorry. Really quick.
That's okay. Okay.
I'm just curious to know, so our kids with a GRI disorder, and for those of them that do have epilepsy, I'm curious to know, does that mean that the epilepsy are called genetic epilepsy, or they all classify as DEE just because they have the GRI disorder and epilepsy together?
Yeah. Do you want okay, you're just gonna. Okay, so I think DEE is really a very specific term, usually associated with early onset seizures that are very severe and that have associated EEG abnormalities that go with them of different types. And so I think it's certainly possible that your child has a DEE along with a GRI disorder, but if it doesn't kind of fit in that category, then it's probably epilepsy mediated by the glutamate gene that's affected, and that would be considered kind of a genetic epilepsy, not the typical genetic epilepsy, which is like a generalized genetic epilepsy. That's like juvenile myoclonic epilepsy or childhood absence epilepsy. It's not that. It's epilepsy caused by a genetic condition, which is the GRIA diagnosis.
Okay, we're wrapping up.